Hey, everyone. Hey, it's Dr. Tamara Beckford with URcaringdocs. Hey, yes. So URcaringdocs, where we provide some great health and wellness information so you're empowered and you know what's going on. But we have some special segments within our URcaringdocs podcast. We have the URcaringdocs Docs Who Care. That's when we bring docs from all over the world who are going to enlighten you on health and wellness info. But the best part is that they're going to leave their info. So if you want to take advantage of their services, you'll know where to find it. That's right here on the URcaringdocs website. So today, I am amped to introduce one of my homegirls. That's right. That's how we do it here, because we got some smart people and they're caring docs. So this is Dr. Vivian Asamoah, right? I'm going to give you her street creds. Like, that's how we're doing it, right? So Dr. Asamoah went to medical school at University of Geneva in Switzerland. Then she did her internal medicine residency at Johns Hopkins University, but she didn't stop there. She decided to go further. She did a fellowship in gastroenterology right there at Johns Hopkins University. And like I said, she didn't stop there. She went even further. She is certified in the Institute of Functional Medicine. So we are going to delve right in with Dr. Vivian Asamoah. Welcome.
Yay. I love your energy. This is going to be a party. I'm loving it.
Yeah,
Dr. Beck.
Yes, that's what we're doing here. Welcome. So I just gave the snippet, but you go ahead and tell us all about yourself, Dr. Asamoah. Go ahead.
Dr. Beckford, you did great. Thank you so much for having me on URcaringdocs. It's really an honor to be on with you guys tonight. I love what you're doing. You're really educating everyone out there. So it is an honor to be on this platform with you, and your energy, girl, you're buzzing tonight. You're buzzing.
That's how we do it. So, Dr. Asamoah, now with this functional medicine, a lot of people are like, what is she talking about? Let's drop the dime and drop all of this information so our patients and all of the general population know what functional medicine is. Go ahead.
Yeah. So I think, a lot of people have heard the term functional medicine. Some people connect it with integrative medicine or holistic medicine. The key word here is medicine, right? It really is going into the root cause of why someone has a certain symptom or disease or illness. When I first learned about functional medicine, I was a little bit skeptical about, what is all of this about, And we see so much of functional medicine out in the media right now. Like, everyone is doing functional medicine. Every provider is doing functional medicine. I want you guys to remember the term is medicine. It is core medicine, right? And so when I started with the Institute of Functional Medicine, I think it was at that point I realized that, if you hadn't gone to medical school or really even gone to, become a DO or done any kind of allopathic training, it was really hard to follow through because, Dr. Beckford, they were going back to the Krebs cycle and the mitochondria, really talk about science and how nutrients affect the body, how toxins affect the body, almost like a segment of some things we had never really learned properly in medical school, and things really impacting our earth, our lives every day as we are exposed to more and more things. We're living differently now, right? And how these affect us results in other kinds of diseases. So you imagine back then, there were a lot of bacterial infections. There was poor hygiene. And so we came up with antibiotics and, how to treat and hand washing skills. But now we've got a whole different set of pathogens. We've got a whole different set of pathogens. We've got toxins, we've got insecticides, we've got pesticides, we've got things that the urban community brings, we've got pollution. And, functional medicine studies the impact of those things on our DNA, on our genes, on our everyday. So that's really what it is. I think it is really a Renaissance medicine, bringing really into this 21st century, everything that can impact someone. And a big part of the underlying root cause of a lot of functional medicine, like when we talk about functional medicine, is stress, is chronic stress. And the impact of chronic on the body, causing inflammation, causing cancer, causing other diseases. And there is so much science behind that. And I really think that that is today the way pathogens and bacteria were. Of course, we got COVID, so we know it can still come back.
Right?
But or centuries ago, I feel like that's what chronic stress is doing to us today, and bad diet, poor bad food choices. Yeah. So I think.
Yeah, interestingly, as you mentioned, chronic stress, dietary changes, and all that, one of the things that we all have been hearing about is how it affects our gut. And one of the things that everyone's talking about is this GERD. Oh, I got GERD. I got GERD. What is GERD? And how does one treat GERD, especially integrating functional medicine?
That's a great question. So let's even talk about, so everyone uses a different term, and you've used the term that we are most familiar with as doctors, GERD, which actually means gastroesophageal reflux disease, right?
Mm-hmm.
And GERD is the actual pathology, right? That's the disease entity. And then there's symptoms of GERD where people say, I have reflux, I have heartburn, I have indigestion, I feel like a sour taste in my mouth. Those are all symptoms of GERD, which is basically fluid from the stomach, right? Refluxing up, coming up into the chest, right? Into the esophagus, the food pipe, and causing irritation and inflammation, causing spasm, which leads to the symptoms of GERD. Yeah, so it's quite common. Mm-hmm.
So how can GERD be treated? Like, how is it treated? And how do we integrate functional medicine in treating GERD?
That's I think whenever you're trying to get to root cause, you kind of have to look at what, we can treat it if we figure out what caused it, right? And, as a gastroenterologist in practice for over 10 years, a decade now, a couple years ago, a patient came to my office and said, well, why do I have GERD? I never had GERD before. Why do I have GERD now? And I was like, you know what? That's such a great question. And so I started digging a little bit more into nutrition and lifestyle, and with lifestyle added stress as well. And I said, well, what has changed for you in the last 3 years? You never had GERD before. You're only 32. What changed? And they were like, well, I started a master's program and I am working late nights and I have 3 kids. But I'm really busy. And I said, well, I can see a lot of reasons why you would get GERD now. First, there's stress. Then you're working late nights, so you're probably not sleeping well. And we know that lack of sleep can also affect reflux, right? It can make reflux worse. You may also be snacking later at night to stay awake to study, right? And then when you're on the run during the day, as you're trying to work with your kids and study, you may not be preparing meals. You may just be grabbing food outside and eating processed foods. So really, it is a combination of lifestyle and nutrition that sometimes will lead to GERD symptoms. So that's one of the reasons why. When you haven't had it you've never had it, and it comes up, like my GERD is flaring. But as a conventional GI doctor, we know that there are some anatomical reasons, like there's an issue in the anatomy of the pipe and the connection with the stomach, where there's a little valve called the lower esophageal sphincter. It's like a little belt, right? And when you eat and you swallow and the food goes into the stomach, that belt should stay closed. It should cinch up. But in some people, they naturally have a weakness in that valve. It just from birth maybe, or they develop it. And it doesn't cinch up. And what happens is that it kind of stays open. So as food accumulates in the stomach and as gastric juices are being formed, it refluxes back up, right? And so there's really nothing they can do, except some people say eat smaller amounts. So there could be an issue with the valve. Another anatomic reason you could have GERD is if you have like a little hernia. So this is different, like an abdominal hernia, like a stomach hernia, a lower abdominal hernia. Sometimes you'll have like a belly button hernia. We know those. But when we talk, when we talk about a hiatal hernia, it's really a little bit of your stomach that rolls up above the diaphragm into the end of the food pipe, right? It kind of rolls up and down, up and down. So imagine if a little bit of your stomach is rolling up into the food pipe, it's going to grab acid and food with it, and it's going to give you GERD. So those are some of the common reasons of reflux.
so I know a lot of times when people, they start feeling these symptoms, like you said, you feel the
Yeah.
heartburn, the reflux. First thing you do, they go to the supermarket, grab some Tums, and everybody's popping Tums like it's Tic Tac, or they're on this tack, the Zantac, the this tack, and the that tack. So those are medications that are used to treat. But there's something that's within the research that you've mentioned, and I saw you mentioning this on your own show, where you said that the chronic use of these medications are not that good for us. Like, enlighten us.
That's true. I think, it's okay if you have reflux symptoms, you indulged over a weekend, drank a little bit more wine, or, had a little bit more like rich food, some barbecue ribs, right?
Great
And you got,
by the way, y'all. And it's the summer.
right? It's the And so it's okay. I think Tums is a good place to start. And I think it's okay to take a little bit of Pepcid, which is famotidine, which is an H2 blocker that also reduces acid. And then you've got that category of medications that are also over the counter in a lower dose called proton pump inhibitors. Mm-hmm. And we often call them PPIs. You may have your doctor say, are you on a PPI? Right? That's what they mean. Proton. You're like, I don't know what you're talking about. So here, I'm going to tell you. So now you know, you got it. Proton pump inhibitors. And these are medications that actually drastically reduce the stomach acid, right? And so even if it refluxes up, you don't feel that burn, you don't feel that irritation. The problem is, you can take a little bit for about 7 days to 14 days while you're changing your diet, trying to cut back on coffee, don't drink as much alcohol, eat healthy, organic foods. But what the problem is when you start taking it for a long time and you're using the prescription dose, for a long time, very often the prescription dose is 40 milligrams and you're taking it for years and years, we know that chronic reduction in the stomach acid, because, the stomach is acidic for a reason, right? Food, very important to digest food, activate your digestive enzymes, right? Your pancreatic enzymes, and also kill bacteria. The stomach, when you lick your fingers or you eat something with bacteria and it gets in that gastric juice, if it's acidic, it just kills it. So it doesn't go into the rest of your body. But when you take the EPIs that, take away the acid, bacteria just have a field day in there, right? And so the studies have shown that if you use these medications for a long time, it can really change the gut microbiome, which is sort of the ecosystem of bacteria inside your gut. And that really affects the immune system. So there's a lot of discussion on the gut microbiome, and we know it impacts almost every part of our body, right?
So this don't want to change. Yeah, I was going to say, so this is all just stemming from GERD and reflux. Like, we're finding out that all of this and this chronic use of this medication is changing the gut microbiome. And that can lead to further issues. So enlighten us to what are some of these leading issues that can occur with this chronic use of medication. And now your microbiome in the gut has now changed. So let us know.
You really listened to that lecture that I gave. I see that you really
thought I was kidding.
Yeah. So there's so much information coming out right now about the chronic use of PPIs and why we want to be careful. There's some studies that have shown that it can actually affect your kidneys. So we see that the kidney doctors are always very cautious when we prescribe it, because they're like, oh, we can see that it can damage the kidneys. We see it can also increase your risk of different types of bacteria, exactly because of what we talked about, reducing that stomach acid. So we know your increased risk of pneumonia, stomach infections, especially colon infections like C. diff, that Clostridium difficile, it increases your. We also know that when you suppress the acid too much, you're not able to absorb certain nutrients. So you can't absorb you can't absorb magnesium. You cannot absorb vitamin B, sometimes even some issues with absorption of calcium. And that's why you guys, you'll see on the ads for PPIs that it can cause, fractures of your hip because you're not absorbing calcium. You lose that strength, right? Your bones become brittle. And a lot of these PPIs, even they actually add magnesium to the pill, you'll see it says, it has the name and then it'll say magnesium, because it strips the body of so much magnesium that they actually have to add it back to the pill. And there's some data as well about even maybe it causing dementia. But we definitely know that it affects the gut microbiome. And that means it may cause what we call dysbiosis, an imbalance in the gut microbiome. And that will cause something called leaky gut, which is an issue with the permeability of the gut. And then that means there's just, once you get that break in the gut and in your intestinal membrane, you start leaking things out that causes inflammation throughout your body. And that's why you want to keep your gut microbiome healthy, right? Yeah.
And see, all of this, it starts with going back to the original nutrition, right? So we're in here talking about GERD. And then we talk about the reflux, the symptoms. We just went and talked about how, usually you're treated and you try to be on medication to reduce some of the symptoms. However, if you become dependent on these medications, now the medications itself, it's doing what it's supposed to do, but it's also going a little bit further. Because why? It's because it's chronically in the system. So it's changing the microbiome of the stomach, because this is where all of this is starting, right? And then you start to now lose some nutrients, right? Because it's just so chronic. And then leaky gut leading to inflammation. Inflammation, now we all have heard inflammation is the root cause of joint pain and a lot of issues that goes on. And like I said, this all started with GERD, which is reflux.
Yes,
so,
absolutely.
Yeah, so this is why I really, really wanted Dr. Asamoah on, because like I said, she is dropping the gems. So with all that we have learned, I know that we've, Dr. Asamoah, this is one of the things that I love about her, right? Other than the fact that she's awesome. She's awesome because she's done both sides of the treatment, right? So she has the conventional and she's done also the functional. So if you're trying to step to her with their info and like, well, I need this, I need that, she got you. She has you because she knows how to do. So if you're like, well, I need to get scoped, and she got you because she can do it all. She is out there. And this is one of the reasons why she's so knowledgeable. And she's also integrating both parts of medicine into a wholesome treatment plan. So Dr. Asamoah, let us know how you treat your patients and highlight some of the things that you do at your practice. And then let us know where we can find you.
Absolutely, absolutely. So, we take a very good history when our patient comes in with GERD. And spend a lot of times talking about symptoms, and people who suffer from GERD can have a variety of symptoms. And I was, as you get more experience in your practice, you realize, it's not always like the textbook says, right? And so I have with GERD who have, voice hoarseness. They're coughing all the time because the reflux is happening all the way up in the throat. And we call that extra esophageal manifestation, like laryngeal GERD. I'm sure you guys have heard about that. Some people even have ear itching, right? Some people have shortness of breath. These are all potentially symptoms of GERD. So we get a very good history besides just the typical heartburn, just to see how this is impacting the person. And then we spend a lot of time, and this is what we do differently at our practice, talking about nutrition. And we say, well, what do you eat? Take me through your day yesterday. I want to know everything you ate and everything you drank, because sometimes we forget those beverages. Dr. Sodas, not good, right? Food colorants and things like that. Coffee all the time, not good. So we have to ask about the diet. And then the last thing we do is we ask about stressors. What's happening in your life right now that's changing this, right? What's going on? Why this sudden? So we get a very good history. Then we dig into the family history. We want to know if there are any family members who have GERD or who have had esophageal cancer, because we want to be very careful in that person, right? That's the kind of person who may need the PPI, or someone who's had diagnosis of Barrett's esophagus. That's when you've had GERD for a long time and it's changing the lining of your intestine. That's a pre-malignant, precancerous lesion. So we want to get those fats, right? You may need endoscopy. I may need to take a look inside and see if this GERD has caused damage to your food pipe, or if there's another cause for the GERD, right? And we'll take biopsies and we'll analyze, make sure there's no inflammation, ulcers, or anything like that. And then we sit down with the patient after evaluating all those things, including their risk factors, and then determine if they need the PPI and for how long they need the PPI. But what we really do, what our goal always is for at least 70 to 80% of our patients don't need PPIs. We focus on lifestyle and nutrition. We have a dietitian in our practice. She will work with you and guide you in terms of what you should be eating, so there's no confusion, what you should avoid. Sometimes it's a question of weight loss, helping you reduce that weight. And we try and guide our patients as much as possible. Yeah, so they can get off the PPI.
Wonderful. And I know as a doctor, that's one of the things we hear very often, right? A lot of patients want to get off medications. How can I get off of this? So one of the things that I want to highlight that Dr. Asamoah mentioned too, is that we try in her practice to get at least, she says, probably around 70% of the patients who are on these PPI might not need to be on it. However, as one of the things that she highlighted, which I want to emphasize, is that there is a segment of the population that still needs to be on it, right? And she mentioned the word of like the Barrett's esophagus, or if you are at risk factors for having esophageal cancer. So if you are, that's, one of the Barrett's esophagus, as she says, if you're having like chronic irritation, like this acid is just going up and just tearing up that lining, then the cells eventually start to turn into cancerous cells. So, so she definitely is going to check to see if you are at risk for that, right? But you also notice that she says it's the whole lifestyle. So it's diet and it's a lifestyle. Like, what are some of your stressors? What are some of your habits? Is there anything that's in your family? I mean, she's digging in. This is a whole lifestyle way of treating you. I'm telling you, I told you that's the reason why I have her on. Y'all thought I was kidding. So Dr. Asamoah, with all of this great info that you provided, let us know, where can we find you on social media? And if there anyone out there who is looking for an awesome doctor like you, who is doing functional and integrated functional medicine and conventional medicine, how can they get in contact with you?
Absolutely. We welcome new patients to our practice. I'm located in Katy. I'm not too far from the Katy Mills Mall, close to the AMC Theater.
That's a little bit outskirts of Houston for those who look like, yes.
I do virtual calls. I do a lot of televisits within the state of Texas. You can find me on social media. I'm Dr. Vivian Asamoah, just my name, Dr. Vivian Asamoah, on my Facebook page, on Instagram, and on Twitter. I also host a weekly, I have a private Facebook group called Natural Gut Relief. That's probably a great place to find me all the time. We have wonderful members in the group. We have a really wonderful family, and we go live every Thursday night around 6:30 on Back to Basics, where we talk about just different natural gut relief solutions, right? Just anything pertaining to gut health, which is a big part of our health. So you can find me on all of those sites.
Wonderful, wonderful. Well, like I said, we have our URcaringdocs docs who care, Dr. Vivian Asamoah. I tell you, she is awesome. You thought I was kidding. Now you guys have just gotten a little bit of all that she does. Well, you can find us on all our social media platforms at URcaringdocs. That's URcaringdocs on Instagram, on Twitter, Facebook, LinkedIn, and also on our URcaringdocs website. That's www.URcaringdocs. I'm Dr. Tamara Beckford with URcaringdocs. We'll see you guys next time. Bye-bye.
Bye. Thank you so much. Bye-bye.
My pleasure.